Now see this question here, you have got a 40-year man who is referred for ophthalmological examination because the vision in one eye could not be refracted better than 20/40. So vision is not improving beyond 20/40 in the eye. On examination, you note unilateral anterior chamber inflammation, stellate KPs dispersed over the posterior surface of the cornea. We have got brown iris with a mild difference of the iris pigmentation, and which one of the following is the most likely true statement? You have to tell the true statement. Now, if you look at the question here, this is a 40-year man, okay, and vision is not getting better beyond 20/40. So, you can say that there is actually diminution of vision in one side, okay, this is unilateral. Then you have got inflammation, so there is a uveitis here because they are telling you about the KPs also. We have got the stellate KPs. Where do you get the stellate KPs, by the way? Stellate KPs we get in the Fuchs uveitis syndrome, that is your Fuchs heterochromic iridocyclitis, and they have given you the evidence also that this patient is having mild difference of the iris pigmentation. So we have got the Fuchs heterochromic iridocyclitis. This is a Fuchs heterochromic iridocyclitis. Now, if you look at the term here, iridocyclitis is there. So, this is the inflammation, and heterochromia. Heterochromia means difference in the color of the iris, and it's a unilateral condition. Now, though it's unilateral, but in about 15 to 20% of the cases, it could be bilateral. So, mostly it is unilateral, but about 15 to 20% cases could be bilateral. We get the stellate KPs and we have got the heterochromia. So, the affected side, if I talk about the affected side, okay, affected side is actually lighter color. Whenever you do the question related to the heterochromia, where you are having a difference in the color of the iris, always see that is it lighter color, the affected side, or darker colored. Because if you are getting the lighter colored, then it could be Horner syndrome also, it could be Fuchs heterochromic iridocyclitis. Darker colored is found with the prostaglandin analogs. So you have to see what it is going. So in cases of the Fuchs heterochromic iridocyclitis, you have got the unilateral involvement, you have got the anterior uveitis, you have got stellate KPs and a lot of iris signs. So what we are having, actually we are having the iris atrophy, and you know iris is a pigmented structure. Due to the involvement of the iris, we have got the trophic patches. This is actually leading to the lighter colored iris, and one side lighter color, one side normal colored. This will lead to the heterochromia. Then you can also have the rubeosis iridis. Another important thing, we can also have the rubeosis iridis because a lot of inflammation will lead to a lot of neovascularization. So you will also have the development of the vessels. We have neovascularization over the iris, and this can even bleed in the angle. This can even bleed in the angle of anterior chamber. Now, what is this called as? When it is bleeding in the angle of anterior chamber, this is called as the Amsler sign. This is called as the Amsler sign, again important. And a very important thing is that no posterior synecdoche. You have to remember that the posterior synecdoche are always absent. So with this background, now I will show you the options. First, they are saying that the involved eye is darker brown. They are saying which of the following is the most likely true statement. The involved eye is darker brown than the uninvolved eye. Less than 2% of the patients with this condition will have bilateral involvement with no obvious heterochromia. Pathological specimen of this condition has revealed the presence of the plasma cells within the ciliary body, or we have got the posterior synecdoche may be prominent. You have to tell the true statement. Look at the option number 1 and give your answer in the comment section. The option number 1, the involved eye is darker. No, this is a wrong statement because involved eye will be the lighter colored. Number 2, less than 2% of the patients will have bilateral involvement. Again, this is wrong because it is about 15 to 20% of the patients which will have the bilateral involvement. If you look at the option number D, posterior synecdoche may be prominent. Not at all. They are absolutely absent. Posterior synecdoche always absent. So this is also wrong. So by default also your answer is C, and if you look here, pathological specimen of this condition will reveal the presence of plasma cells. Yes, because it is an inflammation, so you will get plasma cells also, you will get lymphocytes also in the ciliary body. So answer to this question is C. Alright.